everyone, in this video we'll try to remember the indications of ICD in HCM patients, and it's based on this chart that I have from the ACC AHA guidelines. So if there is a prior event of SCD, VF, ventricular fibrillation or ventricular tachycardia, there is a class 1 indication for ICD, and I think that's easy to remember. I think what is hard to remember is these two-way indications of ICD. So I have a mnemonic for it, and it's HCM safe. So let's go over the mnemonic. And so the HCM stands for massive LVH or left ventricular hypertrophy. S is for syncope, so unexplained syncope. A is for apical aneurysm. F is for family history of a sudden cardiac death. And E is for the ejection fraction, so EF less than 50%. If none of these are present, and if there is non-sustained VT in adults, then ICD may be considered. It's a class 2B recommendation. And the other class 2B recommendation is the extensive LG on CMR. It's usually, there isn't a consensus of how much LG is considered extensive LG, but it's usually greater than 15%. So 15% and then 50% are the two numbers there. They sound similar. The other number that you need to remember is the massive LVH number, which is 30 millimeter. So any septal thickness greater than 30 millimeter is considered massive LVH. And then another 30 number that that helps in HCM is the gradient of greater than 30 millimeters of mercury, and that's suggests obstruction. Obviously, if it's greater than 50, that's when you are thinking of an intervention to reduce the gradients, such as surgery or a procedure. And that's it. Stay awesome.